John's here. Now we start.
Am I in the correct sitting?
Mm-hmm.
Okay.
Let's see here. Let me find you.
Maybe this lady. Good morning. We'd like to call the meeting to an order today, February 4th, 2025. It's 9:02, and we'll call this meeting to order. So we'll have a roll call.
I'm here.
You're here, and I here, so Robert Commissioner Harvey is on the way. So we'd like to welcome the Emergency Medical Service Operation with us and to have a discussion with cities and town. We welcome everybody here and anybody that may be online. And this is a long-awaited meeting and it's nice to be here at this time. And so hopefully we can work some good solution for this program. And so welcome. We went out, we are back. Anyway, so where we go from here, Mac?
Okay, so we have all the cities and towns represented here, as well as the hospital district, and then our EMS director as well. So overall, this is kind of just a giant big discussion of, okay, where do we go here in the future, and what does EMS services look like? So let me pass this out to you.
Can we have an introduction?
Yeah. Heck yeah.
Anyway,
So if we want to just go around the room, Brian, you can start.
Brian is my bodyguard.
So we just go around the room real quick, and I'll hand these out while everybody's.
Okay, I'm Commissioner Stubbs, for those that don't know who I am, and
Commissioner Mon.
Commissioner Mann. And
Mac McDonald, County Administrator.
we have, yeah, and tell him what's your role in the county.
Clerk auditor.
Okay, and Mac, he is I had no brain today. I got a little sleep last night. Anyway, so, and so we can start over here.
City Manager for Monticello City.
Okay,
Jeremy Hobart, EMS Director for Salem County.
okay, behind Trent.
Trent Herring, Planning City Manager. Harley Crofts, Chief Financial Officer.
Okay,
Jimmy Johnson, Chief Operating Officer, Salem County.
okay,
Aaron Nelson, Town Manager in Bluff. And Matthew, Mayor of Bluff.
okay, thank you. And then my husband, Brian Stubbs. He just sit quietly there.
The bodyguard.
My bodyguard. Do we have anybody else online, Max, It's-
Just in case for discussion. Okay, the Commissioner Harvey's on his way. He'll be probably popping in around 9:30. To give you a history on this resolution, kind of presents everything. And so the commission at the time had passed this resolution 2022-2020 or 23, to where we had anticipated moving the organizational structure of EMS back under the health district. But in the resolution, it has kind of the history, and that's really what I wanted to point out is in 1988, they passed a resolution creating the health district itself as a taxing entity. And in that adopting resolution, they had created that for the purpose of health services, which are the hospitals, clinics, and ambulances, etc. And so, also at the time, if I remember correctly, the health district also had 7 clinics throughout the county, dispersed all from top to bottom of the county throughout. And so, in the year 2000, the health district was really struggling financially. They were running in the red. So, in an effort to prop them back up, at the time they weren't able to make payroll. They had some just financial issues, and where it was created as a special service district under the county umbrella, the health district and all other service districts fall under the county umbrella, similar to how we fall as we're a subdivision of the state. Special service districts are a subdivision of the county. So if they go belly up, if they go bankrupt, the county then takes them back over and has to continue to operate those or dissolve them altogether. And so the time the choice was made in 2000 to take the ambulance services under the county umbrella and take it out of the health district so that they can stabilize financially and get back into the black and operate a little bit thoroughly and more efficiently. And so since that time, you kind of see they've been able to do that. They've been able to get their legs underneath them in as much as they've been able to live within their tax plus the excess revenue that they're able to generate as a special service district in itself. When we proposed this back in 2022 for the migration, I had passed the resolution, the commissioners passed the resolution to do so, but then we also explored, what's it going to do financially. At the time, the health district were still proposing the new hospital, a new construction design. They were tucking funds into savings so that they would have enough in savings, but not have to ask for like a high amount on a loan or a grant. And so there was concern from the health district board, as well as one of our commissioners is like, well, let's hold off on making the transition. Let's get them the hospital first. That was our biggest priority, knowing that this was one of the oldest hospitals in the state of Utah. We really need to get a new hospital to function and operate for our future. And we had held off on making the transition. In, 2021, the state law had changed, just indicating that cities and counties needed to provide emergency services, E911 services, at a bare minimum. And in that law, it recognized the fact that either the cities need to provide 911 services on the ambulance, or contract with the county, or the county does it for the unincorporated areas. And so that law was in effect. And so once that law came to pass, we struggled as the EMS team trying to figure, okay, what do we do now? Do we transition it back to the health district? Do we transition it to the cities and give the cities, the EMS ambulances in each respective city? In that analysis, we had generated a spreadsheet that kind of showed each location and the ambulance services that were applied to that location. So if somebody in Blanding City took the ambulance, we initiated and operated the EMS system, but attributed that trip run to Blanding City. So that we do that throughout the whole entire county. So we're supposed to be tracking each ambulance run, where location of service was originated at, and then parcel that out, amongst the cities and the counties. The thought at the time was, well, if it's the responsibility of the cities to provide or contract with the 911 services, then here's how much it costs to operate ambulances within the city's jurisdictions. Now that's difficult for us to track because that we have to ensure that staff, are indicating when they go out on an ambulance run that they're indicating the right area of pickup. That they're actually picking up in Blanding City and not on the outskirts. Now we see this difficulty, especially down in Bluff. We have a difficulty out at Lake Powell. Is making sure that the staff, if they do take an ambulance trip out to Lake Powell to pick up somebody, that they're not attributing that run to Blanding or Blanding area. And so we've had difficulty trying to just track our numbers, and we're trying to get better with our staff so that they know when they do take an ambulance run, of where the costs are coming from. Do they originate out of a county, or are they outside of the annexed area of the cities, or are they within the city's properties themselves? In that spreadsheet, and I don't know, Jeremy, were you able to send me that thought? Okay, let me jump into here real fast. Oh, maybe. Okay. So, you in the audience, let me see if I can blow this up so you can see it.
Shall we have Rosa print?
Should you have Rosa?
Just print this? No.
No.
Can you
no.
guys see that?
Is this the original one that you'd sent?
This, Jeremy, is this it? Okay. Okay. So what we looked at on total costs is we tried to break this down into the run totals and where the runs originated from, and there's some fuzzy math in here because of where staff is putting that it originated here, and milepost 57. Well, where's milepost 57? So we tried to figure that out as best as we could, and so I tracked kind of the number of runs through each year per area. Kind of see the Blanding outside the city limits, Monticello outside city limits. Then you've got City of Blanding, City of Monticello, Bluff, White Mesa, and then kind of the communities outside of that. So with that, we took the average cost of runs per area and figured out that total. And what I was looking at, the thoughts behind it was down below. Let me know if you can't see this, but I had the EMS revenue, EMS expenses, and how much the county had to supplement. And so that supplement total, so we could cover, the EMS revenue and expenses, but knowing that we are now taking general funds to supplement. So I have general funds now paying for the EMS. So EMS on its own is not stable enough to make ends meet. And so because of that, we need help. And where do we get that help was where the question was. So I broke that total amount out into the cities, and this is how much we would, at that time, the thought was how much we would charge to the cities for their portion of the last year's run total costs. And so each city would then be paying the county this additional costs for EMS services in their areas. Or the other option is they take over the EMS services, and then the difficulty with that is then the county would have to pay the cities if they take a run outside of the city area. Like, say, for example, if Blanding were to take on EMS services as the city as a total, all of these runs, that $164,000 is how much the county would then have to contribute towards Blanding City if they took over the EMS services as a city entity. And so this is kind of the picture we painted. Oh, it was 2024 that we had that discussion about a year ago, in an effort to try to, okay, what do we do? How do we get this to where we're not eating out of general funds? We don't have to continue to pay for the additional deficit out of general funds. And so this is that first brushstroke of what does it do. Now these numbers will change, obviously, now that we've closed out 2024. We can update these numbers to kind of show those respective runs in the respective areas. But that was kind of the premise behind the spreadsheet itself, and where we had last left off in discussions. In that, as I met with the city managers, town manager, and had that discussion, one of the questions was, well, how much does the tax pay for, that the health district tax, how much are they contributing to the deficit? And at the time, and still today, the health district doesn't contribute anything for EMS services. Yet one of the arguments is, well, if now you charge the cities for, say, for example, for Blanding, if we charge them the $63,000 a year to make up for last year's deficit and how much was serviced in Blanding City, essentially their argument is, well, now I'm double taxed because we're paying a health district tax for ambulance services, and now you're going to cost me extra. It's like, well, maybe then the health district needs to raise their tax to pay for that deficit, or does it transition back to the health district where it originated at? In talking with and speaking with Clayton, and you guys can correct me if I'm wrong in there, Clayton's concern with taking it back is, at the time when I had the discussions with him, they were still trying to get a new hospital funded. And so they worry about the deficit, no matter what, under whose umbrella, will continue to be a deficit, because EMS services will never run in the black. It can't, by nature. How they've structured it across the whole entire United States, it is this same problem. When you take a Medicare, Medicaid patient, they will not pay 100% of the fees. And so there's always this deficit that on the billing side of it, that we can never collect 100%. We are also stuck at the state costs for services. And so whatever the state dictates that we charge, we have to charge. Or when they increase it, then we increase our fees. When we did the audit, we had an audit. Jeremy started an audit 2 years ago for EMS services, and one of the things that the audit had indicated that we're running in a deficit, and they recognize the deficit itself, but with that they had recommended that the county transition more to a transport system, where we had gotten out of transport, and transports across the US, that's really where they make a lot more money by doing the transport, because you can charge higher. And so that audit had recommended that. And this last year, you had allowed us to transition our pay structure to kind of encourage more transports. And so we've done that, and that was one of the highlights of the audit, to try to make more money with it. But in the end, even if you're transporting a Medicare, Medicaid patient, you're still limited to what you can make on revenue. Now you throw in the fact that insurance companies are getting wise to the game, or whatever you'd call it. Insurance companies now, like Blue Cross Blue Shields, will no longer pay for certain items on an ambulance transport. And I mentioned this in commission meeting couple of months ago, is the insurance companies now are kind of dictating what they will pay for one of their patients that rides on an ambulance. So they won't cover medical gloves, they won't cover bandages, items like that really cut our ability to charge somebody that just has regular insurance, so not a Medicaid and Medicare type fee or bill. But now the insurance companies are kind of starting to dictate what they're paying for. And so you'll continue. My point of it all is you will always continue to see this deficit. We still have to provide our employees gloves. That's part of the PPE. And plus, I'm sure a patient wouldn't want an EMT working on them without having gloves on. And so we still need to provide that medical equipment and have that to protect our employees. But yet it becomes a little bit difficult in the transition where overall what's kind of hurting all EMSs across the nation is the volunteerism. Is it is difficult to maintain and keep volunteers. Volunteers want to be paid. We've had struggles here with our volunteers where, when they're a volunteer on and they're taking ambulance runs, we keep them on our books. We pay workers' comp on them and cover them with our insurance. If they, what we call it, if they abandon their job, after 3 months of a no-show or 6 months of a no-show, we take them off of the books. And so the difficulty with the volunteers is they come and go like that. We've got several that have, they'll not run for a year, and then all of a sudden they want to come back in the system. And so we've had to comply with everything to make sure that they're current in their driver's license, things like that. We have to have them reapply, come back into the system similar to a new employee, and able to get them back on the system and make sure that they're valid and can still run, that they didn't get a DUI during that time, and that they're eligible. So that's kind of created a problem, but really holistically across the system is we cannot get people that just want to volunteer out of the kindness of their hearts to run on ambulance as an EMT. They want that pay. They want pay for their time for being on call. They want pay for obviously when they go out on a run. And so that is part of the problem that's behind this, as well as now that we have to pay an employee wage for this, it only kind of compounds the issue. I think here in San Juan County, we've been fortunate enough, and it got a little narrow to where we have plenty of EMTs to run the system. But when we start making drastic changes, that's when it gets a little tight where, as you've seen, as we've transitioned this pay structure, we were worried that, there would be a loss of those, we call them part-time volunteers. And so you see the state's efforts coming in to try to help with this burden because they understand that's why you have the state's issuance of the insurance program so that they get medical and dental. It's a super awesome carrot that we can offer our part-time volunteers to come into the system, and that helps them. It entices them knowing that we can't pay them top dollar, but yet if you come and you're part of the program as a part-time volunteer, then you can actually have your full health benefits, full dental, to help kind of mitigate some of the issues that across the state that we're having with the EMS program. So kind of that in a nutshell is where we're at. I don't know, Jeremy, if you want to, if there's anything I
just
missed
want to ask a couple of questions.
Go ahead.
And I think Lori has some question too. Okay, my question is, I have been through the process of what we had done, so I understood everything. I was familiar with that. I have a question. Okay, and I don't know who from the hospital can, or where is the money going now that they're collecting from the cities? Where does the money go? Whatever money they're receiving, if they're not contributing anything, where is that money going? And I don't know how much each city pays to the health district. Anybody knows here?
I do.
I would say that question is vague in nature in that the purposes of the tax collected, it says for the purposes of healthcare services. It's not saying for this much is for clinics, this much is for hospitals, this much is for ambulance, this much is for oncology, this much is for cardiology, right? It's the purposes of healthcare services. And so to delineate that this much should have been for ambulance is not, there's no clear explanation in that.
And it's
Okay.
not broken out, just like he had mentioned. So
And-
as far as the tax collection, their property tax revenue on here, you can see is about, so they anticipate in 2025 $851,908. And so that's, like he had mentioned, it's not pigeonholed for anything. It just goes to the health district as their tax. That's how much they collect. So 851, and it's right around that, about 825,000 a year is what they collect. But you're looking, when you look at the overall structure, I mean, they're a $25 million operating expense. And so one of Clayton's mentionings on this, as I talked about, well, you're taking the tax. Well, the tax, obviously a $25 million operating expenditure budget. 800,000 doesn't hardly do anything for their overall operation expenses. Now, the hospital does generate their own revenue, and you kind of see the net or the non-operating revenues, as well as the revenues that come in from their services itself.
Anyway.
So when I looked at, what do we do? So when you think holistically, general fund, well, do we increase the general fund tax, to cover more of the ambulance services and shore up our costs across the board? That's difficult because this other tax over here is also collecting part of the deficit. And so it's just not paying that deficit.
So the thing is, we have this problem, and we're always going to have this problem, but I don't think shifting the money from one place to the next solves the problem. So I think maybe what I'm more interested in is hearing from each of you about solutions, and we're talking long-term solutions, because I don't think just saying, here, let's go to the health district and you shoulder the burden now, even if you were to chip in the money, it doesn't solve the problem. So it's got to be a brainstorm of all of us saying, okay, either we charge a fee somewhere or we do a taxing. I mean, this has got to be a working project, I believe, that we need to work on to come up with a solution. I don't think it's just a shift of the money and where it goes and who has the responsibility of it, because it's something that we have. So if you guys are okay, if you want to say some things that would help us understand.
Yeah, we want to listen to you
to what
too.
you're
and
thinking.
I appreciate Matt giving us a background for everybody, and so we can be on the same page, and we want to take turn listening to you too. That's why we are here, to come up with solution. We're just trying to give a background. We have new commissioners and we have people online, if they are watching, that they know a little bit of the history, what we have been doing up to this time.
Yeah.
And,
Oh yeah, you could stay there. I don't care. You're good. As long as we can hear you.
So I just want to give some background. I think it's been expressed, the background, but like why we are where we are, it's not a mismanagement or a bad management problem. The reason that we are where we are, in my time during EMS, I started EMS volunteering for the hospital in 1996. And at that time I think maybe paid $1 for 12 hours of on call. And we probably got like $5 an hour or something when we went on the call. Monticello, I can only guess, probably did at that time maybe 80 calls a year. So, I mean, it's not that much money. But as the calls continued to increase, and when I left EMS for a few years and then came back in 2012, everything had switched. The book had went from this thick to this thick. There's lots more things you have to know. And then we also, as EMS professionals, started saying, hey, we want to be treated like professionals. Why do nurses get, treated as professionals, but paramedics, are expected to do this job for free? And at the same time, the county and the cities, certainly nobody was being asked to get paid $1 a day to go pick up the trash or take care of the water system or
many of the other essential services. And so we started pushing that issue of why is EMS not essential? So from 2015 until about 2022 is when the legislators finally said, hey, you've got to make EMS essential. And up until that point, it was just a caveat of all kinds of ideas of how do we engage our employees, how do we show them through like some monetary means that we appreciate what they're doing and they can afford to continue to do this job, because what all else happened during that time, as it was expressed with the volunteers, is when I was in 1996, I could leave my job and my employer didn't take me off the clock, and I'd come back. So I mean, I'd get this little teeny stipend from running on the ambulance, and then I'd still get paid. And employers took pride in the fact that their employees ran on the ambulance and were filling in that critical need. And today, it's just the opposite. We are two income households. Nobody can afford to live on one. Employers aren't allowing their employees to leave. In fact, the biggest oxymoron in the entire thing is that the county, San Juan County, can't even figure out how to allow their employees who are certified as EMTs to help us on the ambulance because of some payroll issue.
The federal labor, yeah.
I mean, there's the biggest, one in the room that I can't figure out. So to say that it's somebody else's problem, as far as like, why won't you allow your employees to leave and pay them? We're kind of the pot calling the kettle black. So around 2015 is when we started introducing these different stipends and trying to engage our employees and trying to get them to go take these transfers. And transfers, yes, are a revenue source, but they also, every time we take a transfer, we put 300-400 miles on a truck that costs $350,000 to replace. So like this balancing act of, is the juice worth the squeeze? Now that, as was mentioned by Mac, we are fighting with insurance companies. It used to just be a Medicare-Medicaid problem. We dealt with that. That's our highest payer mix, is Medicare-Medicaid for San Juan County. But now, not even just gloves. I mean, Blue Cross, they're not paying for us for any supplies right now. So for instance, we go run a cardiac arrest, we don't transport that patient. We dump $1,000 of supplies on the floor, and then we walk away. And those obviously don't happen, terribly often, but there is a deficit. And the reason we have a deficit now is that we were building the entire system on the back of volunteers. If we would have put any monetary means to their volunteer hours, this system's always been in the red. Forever and always, EMS has always been in the red. There's not a solution to that. The state regulates what we can charge. It actually regulate that we can't be profitable. If we're profitable, they'll lower the rates. And so the only way to make money in EMS is volume. And San Juan County is not a place where we're going to make volume. Grand County is struggling with the exact same thing this year. They have, San Juan County, we did about 700 calls last year, our service. Grand County does about 1,800 and still can't hit the mark with the volume. And they take transfers all the time. For a point of reference, we have only had to pass up on 2 transfers since October 7th. We've taken every other transfer that we've been requested on. So I think we are seeing some encouragement with our people. Obviously, the elephant in the room is how do we get rid of the red line? And I think everybody here, if we can all step up to the red line with solutions of how to fix that. Like Lori said, it's just a problem. It's not going to go away on its own. We're not going to one person this thing out of where it is. And it's not because of mismanagement. We are running as razor thin of a budget of any department in the county, I would argue. Our people are working for less than most anybody in the county. They're expected to do things that no other employees in the county are expected to do. They're expected to be available at every other hour that all the other employees are not available. So I think it's just something that we really need to respect the fact that they finally made it essential, and we need to figure out a solution to the funding issue.
So what about cities? How?
Trent, you have some comments?
A lot of
Well, you know, this is the time for us to, you know, we are here to learn, and I appreciate what he said, and I want to be able to hear everybody. And this is a long waited meeting, and so this is a time, you know, it may not be all be solved here, but at least we can hear everybody, and we all need to learn from each other. We just talking about what Mac talk is kind of our side, you know. How do we make those numbers count when we don't have the numbers to be adding to our budget when we don't have the income and we are diminishing income and the need for service is growing. So together, I think we can come with solutions, and we just listen to everybody and trying to see how we can really. And so I appreciate any of your comments or all of your comments.
My first question, so I sent an email back in August with a lot of questions, and they've yet to be answered. But looking at a spreadsheet that's in front of you, if I simply look at, let's just take year 2023, and expenses were 803,399, revenues were 461,021. If I do the math, that should only equal supplemented of 342,378, not 520,847. So trying to understand that math. The second thing, trying to understand, if you look at 2022 revenues of 275 compared to the other 3 years that are in that spreadsheet, it's down to 275, 155. You know, why all of a sudden we see such a dip and such a large percentage decrease in revenue? Was it based on turnover? I know there was management turnover at that time, which, you know, may be one of those things. And so just trying to get these numbers to make sense to me is what I want to do. If I remember right, in the meeting that you all had back in November, you had talked at that time that the EMS was running in the red about 160 to 180,000 if annualized. For 2024, that should only be $200,000 in the red. Now, understanding there is a deficit and always will be a deficit, but this resolution that's shared with us here is talking about 500,000 on an annual average that we're in the deficit. These numbers are not adding up to me to the $500,000 on average.
So we probably need to get a clearer
It's so
picture on that.
these numbers are taken strictly out of the budget itself, and so what it doesn't include is the grant revenue.
Well,
And so that's
that was
where
one of
you're
the questions
seeing.
I asked back in August if the revenues included grants, etc.
Yeah,
But still, the numbers that you're giving me here they just don't add up.
yeah, they were just strictly taken out of the county's budget.
So can
So
we look
Laura's-
into that?
Yeah, you want to? What was that?
So we probably need to look into that so we have a clear picture on the numbers. I mean, if we're
Yeah.
if we're
Well,
talking
we
numbers,
would-
we need exact
The
numbers.
thing what we would do, and so we haven't updated this off of your comments and that, and the formula errors. This is just what was presented back then, and so we've asked Jeremy to take a closer look at this and give us an updated spreadsheet, and so we'll fine tune that off of the newer numbers.
And I appreciate that. I guess, you know, the frustration with me as Atlantic City is I asked these same questions in August 13th, 2024. And so we may have been able to have actual updated information here. Instead, Jeremy's hearing this for the first time probably. We're seeing this for the first time. And so with all the turnover, I get that, you know, things can fall through the cracks, etc. But the questions were asked, just not answered.
So I have a clarifying question too, if anyone knows this. So when we define Navajo Nation, are we talking the whole nation? What are we defining there?
Yes. So as of right now, UNHS takes care of anything south of the river and on the reservation. They're going to respond to those calls. We back them up if they need us. We'll go back in there. We were covering a small piece off of 191, I think, to milepost 12. And the issue is we just don't have any coverage at all in Bluff right now. And so we're taking Blanding's ambulance out of service to kind of go to an area that wasn't, I don't know why it was kept. I don't know. I haven't really got the reasoning why they kept this little sliver of the reservation. It's more appropriate. I mean, UNHS can bill at a higher rate. Like, they can bill for those calls at a different level than we can. We have a hard time, billing for them, and that's not the only reason. The main reason is we just can't take Blanding out of service as often as it needs to go out to that area. And so, to answer your question, instead of telling you how to build a clock, they're taking care of it.
Does
Anything on the reservation.
So
Does UNH also come and help with the Bluff area?
No.
Okay,
No.
I just
Blanding-
question just the Bluff.
Yeah, Bluff gets paged and Blanding gets paged at the same time for anything on the 191, 163 corridor all the way to Mexican Hands.
So I'm just throwing this out there as a question. So if we have the health service district, which services the county, and yet we go to this particular line because UNH does here, and we say we need money from you or you take it back over, does that then shift the burden that you technically as a county entity have to service the entire county? Does that make sense, Jimmy? What I'm asking on that? Because we've got UNHS servicing one, but this hospital is a county hospital. It's not a private. Do you see what I'm saying? I know we wouldn't shift that burden down there, but that deserves some looking at because you're talking being equitable.
The health district didn't have a boundary on the south, especially at the time where the health district had a clinic in Montezuma Creek. And so it included the reservation lands as well in that resolution. It wasn't north of the reservation. It was.
But
The
now
whole
we're letting
entire
UNHS pick that up, correct?
Yep.
So then, I just guess what I'm saying is, okay, now we have this shift of funds and we say, okay, you take this, but then let's dump this back over to the health district. I mean, who does that include servicing everyone? I mean, does that include servicing everyone in the county? Am I making sense on that at all?
You are. The other thing, I don't have numbers beyond what we're seeing on the spreadsheet, but, my understanding is that these numbers haven't changed since UNHS took over a big portion, southern part of the county. So the numbers, if anything, got worse. So how is that possible that UNHS has taken over a large portion, but yet these numbers have only gotten worse? And I get inflation and some of that stuff. There's answers to some of it, but I don't know. The numbers are just skewed. The numbers just aren't adding up, and we really need actual fine numbers.
These ones wouldn't. So the UNH, we've been in partner with UNHS long before these numbers. So this is
Right.
So UNHS's numbers aren't included in here at all because it
Right.
was
But
it
the
was
deficits-
previous.
The deficits haven't gotten any better.
No, but they had their.
How is that? How is that San Juan County EMS no longer services a large portion of the southern portion of the county,
Mhm.
but the numbers haven't gotten any better?
When we serviced that area, it was traditionally we would have probably been paying the very, very low, like the offset would have just kind of shot because of like what we were actually paying people at the time, which was probably nothing. And I'm speaking off of maybe because I wasn't here actually during the time of that
Me
transition.
neither.
But that's the only thing I can think of why the numbers. They probably did change, actually, if you went back to the exact year of what the operating costs and expenses were when we had 2 or 3 additional ambulances we were running on the reservation. Because San Juan County EMS did run that area until UNHS took it over.
So we've really got to fine tune the numbers.
Yeah.
That's what we need to do.
Trent, what are your other questions? We're gonna try to figure out how we can, and I don't know who can we assign that. I don't know, Jeremy. I mean, who can come up with the actual numbers?
So Jeremy's been working on them right now.
Okay,
Trying
so
to figure out where they go.
I know you've been busy working on the procedure manual, so we appreciate that. That's done, and so
Yeah, so like Max said, the biggest issue that I've run into is just like the data's not clean over here. I have really no data to go on. I was left a blank computer to take over this job. What Mac has been able to provide me with some data, and then I have to pull all the data in from our PCRs, our patient care report system. I've worked with Peter, for the last several years with budget, like where did this go? Why did this get changed? So we're asking a lot of questions and we're putting data together, but unfortunately, I've only been doing this job for just barely over 3 months. I feel like we went leaps and bounds from where we were to where we are, but going through now, because we can't pull the data exactly the way we want it, because it's just not able to be done that way, that I found out. But I'm having to go through, we pulled all the data in, now we have to clean it up and find out, like how many actual, if we want to know the answer to that question, how many actual calls were in the Blanding city versus outside the city limits, in Monticello versus outside. If we want to know all of that information, and I've been working on it, but I'm having to go through every single PCR and look at the addresses, because the way that our PCR program was set up, it used to have, which is where this data came from, and I don't buy into that it's clean, because it used to have a button that said City of Blanding or Blanding. Our people were never instructed to track this information, so you would randomly pick whichever one you felt like. It didn't get picked because you were inside the city limits or outside the city limits. And so now they've actually removed those buttons. So we're having to go back and look at that data on every single chart basis and say, where was this call? So realistically, I'm not going back past 2024 or in the middle of 2024, and then we've kept data on every call in 2025. Like you asked me how many calls there were in the city of Blanding today. So far in 2025, I can tell you that information. But I can't tell you how many there were in 2023 or 2024 or even 2024 yet. But we do have the data pulled in to start working through it. But it's just a painful process of trying to get what I want to refer to as clean data, and we just weren't left with anything to work with.
So I guess what I want to hear a little bit from cities absorbing any costs. I just need feedback on it.
My biggest curiosity is 2024 seems to be a $200,000 deficit, which is good. It's
Right.
bad to say that's good, right? But that's significantly different than the $500,000 we're seeing, which is going to be a significant difference to the amount paid.
Sure.
I think Blanding City's in a whole different spot than Monticello and Bluff, based on we have Blanding PD that responds to county calls. We can start tracking that, but I don't want to. I don't want to get to that. But I think the updated numbers are the most important thing, so we can see what the actual number is. Simply just cleaning up the numbers from what I have and doing the simple formulas takes it from $63,000 to what would possibly be $46,000. So significant difference of $17,000 right there in and of itself.
So can you guys work with Jeremy on that, cities,
More than happy to do so.
and get some cleaner numbers?
I don't want to reinvent the wheel. The amount of work that it sounds like he has to do to go backwards, is it worth getting baseline data for maybe 2024, not going
Right.
back to 2023 and beyond, but 2024, start tracking 2025, so that we can have true hard data that kind of shows us what it is. Something was done to show the deficit only going to be 200,000 in 2024, so I don't think we should be going back 2023 or beyond that to see what these numbers are. It's not going to do us any good.
And I like the idea because since I came as a commissioner, we've been working on the ambulance system. And so lots of things have been accomplished, and we got lots of changes, which changes are painful for people. And, having been through all of this, I feel really confident that we can do better, but it's really hard to go back to have a history where people haven't been here all the time and things change and the system change. And I like the idea of moving forward with some of your answers, and any other answer concerns you have. I just want you guys to know that we are not here to make it hard. We just want to work together, because this is something we had to find solutions, to be able to provide service. And it's not going to get any better as the lawsuits and different things come about, we have to be more conscious. But the thing is, we are shrinking as a county, and we have to figure out solutions of how we can keep providing the services that we are required to have without draining our budget from other necessities that we need to have. So basically, that's where we're coming from today. And so, do you have any other thing that we can be thinking about, or do you think that'd be a good start to start from there and start building from there? Trent?
I mean, that's a start. I mean, I know you guys use JCI, which a lot of people use JCI for the billing services, and it takes a lot of work, and Jeremy's probably very aware, and someone else very aware of, insurance companies are looking for reasons to deny claims. That's their job, is to deny them, and if we're not gonna fight them, or have a company on our behalf that's gonna fight them. My understanding is JCI, they get paid whether they collect or not. Maybe it's worth having a discussion based on percentage of collections, so that they actually have something to fight for versus getting paid whether they collect or not. If something's denied, it's on Jeremy to go back, look at the paperwork, resubmit it, all, and it's a lot of work, and I get that. And hospitals and clinics, they have full-time staff that do a lot of this stuff. I don't think the county does, or even the resources to do so. So maybe it's worth looking at some sort of contract with JCI, a percentage of collections versus just they get paid no matter what.
Can we get that data, Jeremy? So you could provide that. And then I would, healthcare district, Jimmy and Farley, do you have feedback for us?
I appreciate the comments that have been made, especially Commissioner Mon, your thoughts of, passing the ball or the buck to somebody else doesn't solve problems. Commissioner Stubbs' thoughts of, let's try and move forward. I think from the health district standpoint, we want to be as helpful as possible. Trent's comments have been spot on as far as, whether it's the collections or the cleaning data. I've never seen the data that's on the screen, so I don't even dare speak to any of it, but what he's saying makes sense. Just from a collection standpoint, I appreciate the thought of maybe on a percentage of what they collect, they were paid upon. One of the groups we work with, it's as low as 15%, and so they have a lot of skin in the game and high motivation to get things done for you, because otherwise they're just working for free. But on what it sounds like, the current contract, I don't know that there's any motivation for them to try and collect your outstanding balances, because it's way easier to just write it off and say it was too hard. But if they have skin in the game to say we're required to do something, I think that would change. As far as new hospital, you asked a question that I think touched on, well, what is the money that you're collecting as a tax due? I think that's important to understand and know that our responsibility would be about $1 million to pay for the new hospital on an annual basis. So the property tax that we do collect is absolutely going to go to that new hospital. We've tried our best to ratchet that rate down where we can. We haven't collected to our max in years. I don't know an exact date, but we've either stayed at the certified rate or have gone below in an effort to try and help ease the burden.
That's been intentional, right? If we're able to sustain financially, we want to ease the burden off the citizens as much as possible. And so instead of collecting at 0001, we're quadruple 08 at this point. So we've been intentional with trying to lower our tax rate, understanding that.
So when the cities are paying the money that's required from each city,
The cities don't pay money, it's each individual citizen of San Juan County that pays the property tax.
yeah, but whatever we considering that we paying double, do you know what I mean? So that will happen either way. The money will be going either way. Either suppose we don't have an ambulance service, the money will still go to the health district. So we just think about, with knowing how much it actually costs to do the service, starting checking last year and going from there. Then for us to think, well, we are already paying for this, we shouldn't pay for that. And so it's just basically trying to understand where everybody's coming from. I understand, Trent, your frustration with us, and and we have it in every direction. We have so many departments that we, since I came up on board, that we've been trying to work and fix and do, things. And it's, our time is just, the days just go by so fast and seems like we get behind and behind. But we appreciate being here, and I'm glad that we're making some progress. Bluff, the Bluff has anything that you would like to say?
I think the only thing is that we agree with Trent, the numbers aren't making sense. And I know Aaron has spent some time talking to the other managers. So we'd like to see the data that really will help us understand where we're at. And Bluff is struggling with the numbers of calls that they're not able, that they haven't been able to answer. So we're looking at how we beef up recruitment and those types of things. But I think in some respect our EMS people are a little taxed by the bureaucracy piece of getting them on board as employees and moving forward.
I think there's a great deal of frustration and lack of morale. Clearly, I appreciate Commissioner Mon's comments about trying to look at the entire system, because I do think it's system-wide. I think all of San Juan County feels the pain that there just aren't enough people to go around. And so when we talk about recruiting anyone for emergency services, you're either taking away a business owner operator, you're taking away their critical staff when they're having trouble staffing their business anyway. And so I completely hear where Mr. Hogarth's coming from, because there just are, the situation just is not what it was a decade ago. But I do think that, with strong leadership and expressing to these individuals that they are critical elements of our communities, and then treating them with the respect, I know it came up, and I completely understand from the county standpoint that you cannot keep people on payroll and covering insurance if they're not responding to calls. But I do think that if we can have the conversations with individuals to say, hey, you've got this skill set that is incredibly important, what can we do to bring you back on? And I know, in speaking with individuals, it's not necessarily about the money, but it's just, being able to show them that they're valued. So I'd love to talk about how we encourage people to sign up. But yeah, absolutely. I mean, Bluff has been kind of a weak link, and not for lack of trying, from the individuals who do show up. If any of you know Kathy Carson, she's been a dedicated individual
awesome.
for 4 decades.
Yeah.
I mean, that's
Yep.
crazy, but we can't expect the same people to keep, we're just wearing people thin.
So-
And so we agree that, this has to be a system-wide issue that's being addressed. And then certainly when we start talking about the financial impact, clearly this is a critical service. I have an aging population in Bluff. We need to have people available, but I also do want to say, if we do end up, looking at this and looking at additional funding to go back towards the county, it's critical that we have the same resources that are well maintained, that are not aged out. And it's hard. I know resources are stretched really thin, but if the town is at all looking at paying anything towards the system when the numbers are worked out, it's critical that our people have the resources so they can do the jobs that they're being asked to do. And that has been an issue and is also contributing to low morale when they don't have the ambulance that has stuff in wait. People show up and they're giving it their all when they don't have what's needed for them to succeed.
I have a question. How many volunteers in the ambulance you have in Bluff?
We have
3.
Three. And so,
yes, thank goodness.
so,
So that's 3. So you imagine 3, 7 days a week, 24 hours a day. That
Yeah, they're tired.
they're not 3 all the time, and so that's why we have Blanding responding to Bluff.
and so, we are trying to be positive here, and I understand that, but also, before I came, I got to listen to lots of the people talk, and lots of people talk about, including people from the EMS, about the hardship they have serving more than one community. When we had 3 ambulances sometimes, one sometimes goes to Bluff. One, is there some times where we had to get help from someplace else because Monticello. Anyway, so we all trying to, and we are not next to each other where we can just go and bring a patient. It takes time. So I think it kind of started with all of us understanding that volunteers don't come anymore. Just the way the economy is, the way housing costs and bonding, people had to work two things. And I think we had to somehow even have a positive attitude and understand that sometimes why we had to make changes. And like I say, changes are hard. Companies, big companies spend lots of money on making changes. And that's one thing that costs company lots of money. And this has not been easy in trying to explain to people, but I feel very optimistic we have something good going on, but we had to also trying to understand how the decision that sometimes we had to make as a county. And if things don't improve with the economy, it's going to be lots of service we're going to have to cut. And I hope this is not service like this. So we had to figure out how can we really work together, because I think it's very important. And it's just even trying to, I know certain areas suffer more than others. I know that, La Salle, they feel like they need more help and different things. And we just have to figure out ways that we can make work. And so I appreciate about the blending people that are so willing to go and help. And I don't think that the personnel had to be making choice. They're in the right place to serve. They're there to serve, and I don't think they had to have the pressure. They might go in and here and they're going there. I think that whatever Black can do to help, I don't know if there'll be any way that you can figure out ways that we can kind of help.
We've been working on like incentive programs, and clearly it's an area that we'll continue to evaluate and contribute, especially in our upcoming fiscal year. But like we're definitely going to cover the cost of people taking courses, of their exams, and things like that.
Yeah.
But we don't. I think one of the things that we struggled with for emergency services in general, including fire, is that we can't necessarily directly pay individuals or give them stipends, because then it counteracts what the county is doing. And so even if we wanted to and we had the funds, we would not be able to financially contribute. What we have said though is like we'll help cover the cost of like their personal clothing and uniforms and things like that. And so trying to defray some of the costs to the individual while not actually paying them directly, because we don't want to cause issues there. But I think that's a great thing for us to talk about, is like what other incentives can we offer as a small community to even get people to take the class. I mean, just that first step has been really difficult for us to attract qualified individuals.
Well, thank you. Do you have any questions?
So yeah, with this discussion, I would like us to circle back around probably like April. I mean, could everybody commit to that? Like the first, we could do a work session. The first, is that enough time, Jeremy, to gather what you need? April, if we did, and revisit numbers, revisit this conversation, and maybe we have a great brainstorm between now and then of what we could do or come up with.
The Monticello has any question, any
What's
concerns?
Yes, a few things. I agree with everybody here. This is something that we've got to solve. We've got lots of brains in this room that know a lot more about EMS than I do. One question I do have is the numbers in front of us. Are these all just calls originating from Monticello? So say it's a visitor who's at the hotel who needs EMS services. Are we able to differentiate that type of data between a visitor or a local resident?
In 2025.
In 25. Okay. I'm just curious to kind of see those numbers, because I'm looking and thinking, okay, if Monticello has to contribute, where can I pull funds from to make this work? And so seeing that data would
And another
So go
question,
first.
also, since we have a monument, we have a lot more people traveling this direction, and we have more accidents. Seems like, I don't know. I mean, I don't know if I'm paying more attention to accidents, but it seems like we having more of those. So I don't know if those bring different um, sources of money for the county, and so there's lots of things that we're trying to figure out how we can um, operate. But so if you
Actually, those numbers would be great because um, I just some ideas that have been rattling in my head is like people that come to recreate and bring an ATV. You go into Colorado, you pay a fee to, you have to have a permit for $25. I mean, I don't know if those are some things that we could instigate in our county. If you're coming across county lines and you're going to be in the area, then you've got to have the permit. And then maybe I'm just throwing this out there, and then we can designate some of those funds for our search and rescue and EMS. And I mean, those are the types of things I would like us to think about. Or even I know that a lot of people go and rock climb down, and it's on BLM land. It's something we'd have to work out with BLM. But if there's a way you have to have a permit to do, everywhere else we go, we're permitted to death, or you pay a fee to enter. So, but that's something that Mac would have to look into, but something we could push on our end and maybe attach some fees for those people that use these services that are not from our area, that take up a lot of resources and money and time. So just some ideas we need to think about. And that's kind of what I'm asking, is that we all think outside the box. What in your community would be some way that we could capture some more funds in some direction or another? So, wow.
Commissioner Harvey, do you have any?
Yeah, thank you, Madam Chairwoman. My first thought is regarding our emergency dispatch system, and this is just me expressing my frustration, and I don't want to offend anyone in the room, especially our administrator. But it's now been 2 years?
2 years since we made that transition.
And we've been hoping we tour their facility, meet the people that run that operations center, and have a deep conversation about our county. Because when I first came into the county, one of the things that I've learned was Monticello no longer dispatches, and it's not local anymore. It's actually outsourced out of our area. And the biggest fears coming into that reality was, how can someone who doesn't live within our area understand our geography and our needs, and how do we coordinate when there's no addresses in our deserts and canyons? And I don't know if they capture calls and have records of the type of emergencies they're collecting. Since I've been commissioner, I've never seen any report from this organization that gives us an annual set of numbers to review. I don't know how much money we pay for the service, but I think that's a conversation worth having, is if we're spending X amount of county funds for a corporation company that claims to be collecting phone calls and knows our geography better than we do, surely we have to have some data that we can benefit from. Whereas benefit of that relationship. And maybe there's a way to share that information with this group. Is my thoughts. And I think I'll keep my comments to that for now. Maybe there's a way to finally have that tour, to finally sit down with that organization to have a conversation about emergency calls and numbers and reports. Because right now it's a closed door. And I'd like to walk into that room and learn. So that's just my thoughts, commissioners. But we do need to continue to have this dialogue. I've never had EMS in our county sitting in a room together like this, staring at each other with smiley faces. We need to have more of that. Because we've become strangers in a sense. So Commissioner Mon, Commissioner Stubbs, thank you for bringing everyone into the room, because this conversation needs to continue. The more we can have it, the better. So, and just another thought, we have a public health committee. Maybe we need to have an EMS under the county as a committee. That's not my solution, but that's just a thought, so that there's monthly meetings to coordinate this. Thank you,
I appreciate
Commissioner.
your comment. Another reason why to have physical address in our county. Some people, they're returning to the reservation because they had left the reservation, have a professional, worked for 30 years, are returning back to the reservation. And there are many reasons, but one of the reasons they say they want a physical address so they can have a package from Amazon delivered to their door. And it's really hard because they can never find the packages. And that's something that I have been working on, trying to work with in the county for us to have physical address, and that's so important to be able to have. And even when you know your physical address, it is so hard to get help. I had a relative that anyway dug into the gas line, and there's that dancing like a snake when the gas is coming out, and you're trying to get help. And when you get 911 and you say it's across the Baptist church, when blinding people know across the Baptist. And when you're even if you know your address, you just cannot even think. And so when you don't have physical description, sometimes trying to remember your address or whatever, it is so important, that somehow we find out how that system works. But anyway, thank you for that. And you have some.
Trent had a comment.
Yeah, Trent.
Yeah, so the dispatch services that are paid for by San Juan County, Blanding, and UNHS in San Juan County, they work on fiscal year July 1. They send a report every year to the number of calls, the amount that we're either going to go up or down, and what we owe for the following year. So that does happen every year. That report's sent to everybody that's part of that. San Juan County, unfortunately, is 23% of the entire dispatch calls. So it is a high amount. But based on the amounts paid, in my opinion, it was a very smart financial decision to move dispatch out of San Juan County and up to the price dispatch, just based on cost alone. Equipment, you've got to have 2 full-time employees at all times for dispatch. And jailers, my understanding, were being used kind of both ways for that. I do think it was a smart financial move to move dispatch up the price. In my opinion, on the calls, they actually went above and beyond way too much. When there was a fire in Bluff, they would page out 5 fire,
Including LaSalle. Yeah.
because they didn't know the area. So they actually go
At
off more
first,
and
yeah.
they're learning the area.
Yeah.
I appreciate Commissioner Harvey's comments on that. I think it's very important that we follow through on that. I do think we need to talk to our officers and our ambulance services to see, are we seeing problems with the addresses? Are we seeing problems with that type of stuff? But financially, it was a very smart move to move that price.
Yeah, it just matter if you have a physical address, it's easy to find. There's no areas where there's no cell service, and it's kind of really hard to communicate. And so, if you think somehow, anyway, something to think about it. You have any more comments? But I like the idea of getting together. I think that it's lots of possibilities that we can do. I mean, exploring and brainstorming some of the ideas about like having fees. We are a county that many people, the people that visit our county are people, families that cannot afford bigger places, and they pack the food and they pack everything, the tents, and they come to San Juan County, and we sell them gasoline. And so I don't know if we attach fee or other things, but it's a good time for us to brainstorm all kinds of ideas and keep that in mind. And I know a year or so ago, Commissioner Adam, we presented a resolution about opening San Juan County for business. And I just want to throw out this, maybe you guys are all aware of this, but about 2 or 3 years ago, there's what they call a leakage study.
Sales tax leakage.
Was done by
Science
Bank, and it tells the category of where we leaking funds. And the only place that we make money is some tourism and some in gasoline. Accommodation and gasoline is where we make the money. We are losing over $90 million leakage going out of San Juan County to other areas. And that goes from construction material to all types of things. And so when we say we're open for business, we want to be able to attract people that come where it's not so costly for them to come and build and do things here. And so we had that put out there, and so we always trying to figure out how we can attract people that my thing is inviting people out of the legislature to come over here and do meetings, and we've been doing that. And I can say, well, we got this much money here and there, but we need to keep bringing them in this area and keep doing things, and because people are not coming this way, they like to go someplace else. We just need to figure out ways to attract them, and I don't know if we Trent, you're aware of the study. I can forward you that study where you can see where the money is going out of the county. And it's easy to learn because it's cars. We don't have car dealerships. The other thing is building materials. There's all kinds of stuff that we can figure out how we can work on that. Anyway, so is any
I don't have anything else.
Peter, are you here for this or for another meeting?
No, I'm next on your agenda.
Okay.
For the next meeting, I'll miss it all.
Oh, sorry.
Yeah,
Okay.
we don't start until 11. You get till 11.
Thank you for coming, though. We appreciate it.
Yeah.
I think these conversations
It's
are
up to you.
healthy,
Yeah.
and that
Yeah.
we can accomplish a lot when we
I'll-
talk.
I was hoping there would be other people here too. But thank you for coming, and I don't know if anybody else have anything else they want to add to it.
So we'll just add it to the work session on the April 1st meeting. And so
Okay.
let's plan on next one, April 1st. Then hopefully by then we'll have that spreadsheet with the updated numbers, and then we can go through that with some suggestions.
Will you send a meeting invite when we get
Mhm.
close?
Oh yeah, yeah,
It'll be a work session again.
Yeah.
it will be. Yeah.
9.
Yep.
Okay. Anything else?
I might have conflict with that day.
Well,
You up?
Yeah, but I'll be at a director's conference.
Oh,
Alright.
is March too early? The end of
So,
March one? The
March
middle
will
of
be
March one?
hard with legislative session.
Oh,
have another meeting in April.
We can
the
do the
15th.
second.
right?
Yeah.
That's the 15th.
So the 15th would be the next.
Can you guys do?
It's tax day. So
Hooray, our favorite day.
it's when taxes are due. So we can put you on the work session for the 15th.
I kind of probably need to be here.
Yeah.
Does the 15th
Yep.
work for you?
We want to be able to have you here, Jeremy. So
So April 15th it
Okay.
will be 9 o'clock. All right. We'll get it teed up.
thank you for all your good comments, and
I forwarded you all the dispatch numbers.
Th- thank you so much.
Sheriff receives those, and so we'll have to make sure.
We appreciate that. And if you guys have any suggestion that we can find out answers for the next meeting, well, that'll be appreciative. Maybe as you're thinking something, you can just send it to us, and then we'll start being prepared when you guys come next time. So thank you so much, and do we have a motion to adjourn?
Work session?
I'll make a motion to adjourn.
I'll second.
You'll second. All in favor, say aye.
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 Thank you.
Thanks, everybody.